Okay, well, happy Monday, everybody. This is the beginning of week 13 of this pandemic. 13 weeks of living a completely different life than what most of us are used to. And slowly but surely, things are opening up. Now, of course, I don't need to tell you about all the protests and the people on the streets. Governor Cuomo of New York said that anyone who protested should automatically think that they have been exposed to the virus, they're positive, and should go get tested. I asked that question today of Dr. Ferrer, and we will play that for you. Her response was interesting. Doesn't quite agree that way, but she has cautioned over and over again that if you are out protesting, please wear the mask. Please try to keep your distance. But you've seen from the video that's impossible. And at some point, you've got to isolate yourself if you think you've been exposed and then get tested, but not too early. It's kind of complicated, but the bottom line is if you go get tested now and you're negative, that doesn't necessarily mean you're not exposed to the virus. Remember, this is a 14-day incubation period. So the best thing to do is if you feel you've been exposed, and you're out there protesting and you're near someone who didn't have a mask, or you just want to be cautious, you have to pick a time when you're not going to be out there anymore and then self-quarantine yourself. And if you have no symptoms for the 14 days, you're free and clear. If you get anything in that 14-day period, then the minute you have any kind of symptoms, you get tested, and then you'll be able to find out if you're positive or negative. It sounds a little complicated, but the best bet is use your own judgment on this. You know if you've been too close to someone. You know if you wore the mask. You know if you were next to someone who didn't have a mask. You know if someone breathed on you or, accidentally put some saliva on you. I mean, it's just, you have to use your own judgment, but be very, very careful. Will the numbers spike? That's the big unknown question. Right now, today, the numbers were pretty good. It's an all-time low in the number of deaths. Only 10. I say only 10. One is way too many, but 10 in the last 24 hours, and that is the lowest in the last 24-hour period since they started keeping statistics when this pandemic began. Number of positive cases, 800. You probably heard on the radio today that a lab reported, that's been taking a lot of coronavirus tests, that there has been a spike in the number of positive tests. Dr. Ferrer explained that. That lab more than likely handles a lot of tests that are from the assisted living homes. Those people test positive at a greater rate than the general public. Their positive rate is anywhere from 10 to 11%. So it may very well be that this lab had a rash of testing from the assisted living home people, and as a consequence, it did go up. But overall, and again, this is a real significant number to remember. I don't want to hammer this too much, but it's very, very important. The number of positive cases is now 8% in LA County. We've had more than 708,000 people tested. So the 8% represents the lowest number yet. Hospitalizations at the lowest number yet, just 11% of the more than, what is it now, approaching 64,000 positive cases. So of that number, only 11% have been sick enough to be hospitalized. Those are two very encouraging numbers. And based on those numbers and a few other things, the county wants to reopen a little more this week. They're hoping they can get some bars open, they can get the gyms open, they can get some schools, give them a little criteria how they can reopen, and also some of the summer camps reopen. All of that is likely to happen this week. We'll know more about that probably on Wednesday or maybe on Thursday at the very latest. Don't know what we're going to hear from the governor later on this week. He spoke very, very impassionately about the situation that's going on in our lives regarding all the demonstrations and the protests. So I don't know what he's going to say if he's on tomorrow or on Wednesday. So other than that, despite the fact that you see all these people in the street, don't think that there's going to be an automatic spike. It may not be, when we won't know for at least another week to 2 weeks. But the county is planning to move forward. They want to reopen more of the economy, and that's a good thing. And let's hope they'll be able to do it. So we'll keep it short for now, and we will talk to you tomorrow. Take care.
Governor Cuomo said recently that anyone who is protesting should assume they are positive, that they've been exposed and that they have the virus and get tested. Do you agree with that?
I want to just do a little reality check, which is that we've been saying for months that everyone is probably best off assuming that they could be positive and that other people could be positive. So it's really not necessarily related to the protests. It's related to the notion, and I think the supervisor said it best, of universal precautions. Because we don't know at any moment in time whether we're infected or whether somebody else is infected, the best thing you can do as you go about your business is assume that other people might be infected and that you might be infected. And that's why we, really stress how important it is to do the two things that we all can do, because there's a lot of things out of our control right now. We can wear a cloth face covering and we can keep our distance. And those are the tools that we have. And, my sense is this goes for people going back to work, this goes for people going to the mall, this goes for people going to the beach. And it's not just an assumption you should make if you were a person who participated in a protest. It's an assumption you should make as you go out and about, getting back to some of your more normal activities, because the risk is still there. And even though it may not be a huge risk, it's enough of a risk that we all need to take these universal precautions.
There was a report that said that there's been a slight increase at some of the labs of positivity rates. For example, it went from less than 4% at this one particular lab to almost 9%. Is that true?
Just to clarify in the lab results, we do put in our table, the percent by each lab, but I want to say it varies a lot, both in terms of how it contributes to the overall rate, which, as you note, Dave, has stayed below 8%. But it contributes depending on who's sending specimens to that lab. And sometimes, for example, there's a contract with a whole host of nursing homes that goes to one lab. And that could actually, because at nursing homes, our testing positivity rate is hovering about 11 or 12%. That would increase the positivity rate for the specimens going to that one lab. The important number is the total number, the cumulative number, and that's really stayed at about 8%.
I know you want to open up more, Supervisor, but is there any fear that maybe you're moving too fast and we still go ahead and try to open up the county even more on Friday?
Make no mistake, we are doing this in a very deliberate and cautious way, and actually have been one step behind the surrounding counties just for that reason. Because of the size, 10 million people, we recognize that there are a lot of other issues that come into play, but we also recognize that the longer we stay closed, knowing that we actually can do it in a responsible way with social distancing and encouraging people to wear face cloth coverings, that we need to get back to work and get the economy back working, and we can do both. It's not an either or.